So when you were still over at Duville, you were doing work with the Community Health Worker Network of Buffalo. Now I'm kind of morphed into Connect, even though Community Health Worker Network of Buffalo is still around. So that's how we met. You were doing a lot of research, and then bringing your kids out to different events. You and Jess and Rawa and the whole crew, and then you started talking about this concept that every time I think about it, I always credit you in this community-based participatory research. And as a researcher, um, I really began to just value your role on the team, because I think research seemed like this super lofty, critically focused thing where like only people behind computers and in books are like doing it, and it has to be super technical, and you can't make any mistakes, and like it has to happen in a lab, and all these other things that like when you're not in it, you grow up thinking. And I had a degree in psychology, so I had some basic knowledge and understanding of research, but also having that degree in psychology, I'm from like a let's what's the study kind of a standpoint. So working with you, just having the privilege to learn that like no research, it is that, but it's also like living surveys. If you got 30 people in the room, that's a relative sample of the population. You can start asking questions and drawing percentages, and you can simplify it and make it more practical and useful if you're not about to write an academic paper. um and so just really that was like one of the things where I was like, yo, she is dope, because now I can take some of stuff that like may seem philosophical, and I could communicate it to people in a way where they can understand it. So yeah, just talk to us a little bit about how you got involved as a community advocate, and using your skills in academia and research to really give voice and help paint the picture of the disparities that's happening in the community.
Yeah, I guess that goes back about 13 years or so when I first became involved with the Community Health Worker Network, and it was really through like a 2-day what they call a stakeholders training. So folks who are kind of peripherally involved in the work of community health workers, but not community health workers themselves. So what we now call community health worker allies. Um, and I just was so compelled by the experience within that training. It was humbling. It was a reminder. It was engaging, and it helped me to connect then with kind of where my heart was in doing health disparities research, and that's working directly with people who know firsthand
Hmm.
what those factors are, what the things that affect whether you can access healthcare, whether you have a healthy and safe home to live in, whether you have access to food. Community health workers are on the front lines doing that work, and so working directly with them on research related to that just made sense. So in that process of getting to know that work and being an ally, I also, as you said, started facilitating trainings, which let me meet so many people and hear so many stories. And while I do quantitative research, which means collecting that hard uh, discrete data, right? Like
Yeah.
I also do qualitative, which is the story. It's the context. That's really the anthropologist in me. It wants to know the what's really going on the ground. Doing
Hmm.
that like ethnography, that observation, and writing down the stories, and being in spaces with community members and community health workers really fostered my love of community, but also contributed to my understanding of root causes of the issues that we see in our community and
Yeah.
possible solutions that we should be trying, to address those issues.
Yeah, I think like that's super dope, just because just working with you and just with all of just everybody else would connect, and the community health workers, just thinking like, okay, everybody does have a role to play. And so like when you can recognize like your teammates strengths, like you really um are able to kind of recognize your own, and then you're able to lean into like, okay, so I'm really good at this and I'll lean into this, but like this other person is really good at that, so how can like we lean into that and become like a super dynamic team. So I think that for me was like I want to say like was like the greatest treat of just meeting you and working with you, especially facilitating with you. When we would go out doing those in-service trainings on like cultural competency and the different community health worker competencies, just how like dynamic we are as a training duo, and just the benefit that I know the audience is getting of like you have me and Renee show up, like it's gonna be a good training, and like you gonna get a wide perspective of experiences and information. So yeah, just talk a little bit about like coming from behind research and then like really facilitating it and advocating. So what has that experience been like for you? Because a lot of folks who do research don't usually like come to the forefront. So what's that experience been like for you?